The health scares Daniela Skeeny has faced over the past year are terrifying. Fighting cancer, she was without insurance for 5 days in March while her husband changed jobs. In that short window, she got COVID-19 and had to be hospitalized.
I went online and I saw the bill, which was $35,000, and it just made my head explode.
And that is only for COVID-19 treatments. Even though the president approved a bill to provide emergency funding to cover some costs, as Skeeny found out the hard way, it's far from a blanket policy.
You have to apply for every other type of aid that you can possibly apply for first, and they have to deny you, and that takes weeks. Then the hospitals can forgive the cost, but it is up to the hospitals. There's no guidelines.
Her bill has not been forgiven. As a public health advocate, she also worries about the millions of Americans who've lost jobs and subsequently their health insurance in this pandemic. A new study found of the 27 million newly unemployed in March and April, 21 million will qualify for some form of public health care coverage, meaning 6 million are now without health insurance.
My fear is that we're going to have a second wave of suffering as a result of people going without needed health care because they can no longer afford it.
It's a fear shared by this Detroit doctor who is hearing from patients fearful to seek treatment.
Some of them are telling me, oh, you know what? I was really sick last month. I probably had the COVID. I almost felt like I was going to die. And I'm like, well, you didn't call us. Did you go to the hospital? No, I knew there wasn't any cure for it. And I was scared to go to the hospital, and I was scared of medical bills.
Before coronavirus, polls showed most Americans liked the health care coverage they had through their employer. But with the jobs crisis deepening, the public mood may shift. Katie Simpson, CBC News, Washington.